It's time now for our weekly Healthy Living Matters segment brought to you by our friends at Community Medical Centers. Each week we talk about various subjects when it comes to stroke awareness to educate and inform and also arm ourselves with preventative measures. So if someone we love has a stroke, we know what to do. And this week our doctor is again Dr. Wish. So thank you for being here. Let's talk about what actually causes a stroke. So we've talked about risk factors if you have high blood pressure or if you lead an unhealthy lifestyle. But what is actually causing a stroke to happen?
So there are two types of strokes. One is an ischemic stroke and then it's a hemorrhagic stroke.
Okay.
Most common is the ischemic stroke when there is a blockage in an artery that supplies the brain is cut off, so there is no blood flow or oxygen to that part of the brain. And hemorrhagic stroke is the one where there is one of the blood vessel ruptures causing the bleed into the brain and causing a stroke. The blockages is one of the most common cause, and as we discussed about all those risk factors are at high risk of causing those blockages.
Is that because you tell me, you give me a lesson here. Is that because the vessels that are providing the blood are getting smaller or they're getting blocked?
The vessels that are supplying are getting blocked.
Okay, similar, but different. Similar to if we have a blocked artery maybe in our heart.
Yes.
That way.
Yes.
And what leads to that? What causes that to happen?
There are several factors which can lead to that. A person who has diabetes or high cholesterol is at high risk of forming a plaque, which can slowly grow over years and can cause the block. And there are people with heart conditions, with abnormal heart rhythm, what we refer to as atrial fibrillation.
Yeah.
They are at very, very high risk, and they can form the clots in the heart, which can get dislodged and go to these blood vessels and can cause these strokes.
So it's really important to know if you have these high risk factors that it could lead to that. So
Yes.
it's very important to know what the symptoms are. The other stroke, the hemorrhagic, am I
Yes.
saying that correctly?
Yes.
How does that happen?
So that happens mainly due to the blood pressure, a very high blood pressure, and which is not controlled well. And sometimes when the blood pressure is not controlled well, those blood pressure becomes weak, and their walls can become weak and get ruptured and cause the hemorrhagic stroke.
Is that what you see? We've talked about drug use before. Is that what you see with drug users?
That's what has been the trend so far.
Right.
Like when people are using more drugs, like stimulants, what it causes is increase in the blood pressure, which causes the hemorrhagic strokes.
Right.
And they're also at risk of other ischemic stroke, which causes the blockage because they're at risk of forming the clots as well.
Right, and I've listened to Dr. Drew for years, and kids will always ask, what are the side effects of these certain drugs, and he always tries to drive home the point, like your body is your body, but your brain, that is what it's going to affect. So these sorts of stimulants can really affect how your brain functions.
Absolutely.
And if you don't know that you're having a stroke, that can be even worse.
Yes.
So if we know the acronym, we know BFAST, we identify a stroke, we know somebody is having a medical emergency that's affecting the brain, what should we do? How do we act quickly so that we can get intervention for them?
So as soon as a person is displaying these symptoms of stroke, one should immediately call the 911, and the EMS knows where the stroke centers are. And at CRMC, we have a dedicated stroke team who are all fellowship trained stroke neurologists and interventionalists and neurosurgeons who are all on board when a patient comes, and we will evaluate. And because time is essence, we need to give that medicine. Remember, it is if they come only within 3 and 4.5 hours. We cannot give that medicine after that.
Why do you think, so this to me sounds very similar to if somebody were to have a heart attack.
Yes.
Why do you think people perceive these two episodes so differently?
Well, it is the awareness, and that's why some people also refer this to as brain attack.
Yeah.
Like something similar to heart attack.
Right.
So we need to create more awareness that this is more like a heart attack.
Yeah.
And then when a part of the brain dies, they lose function of the brain, which may be in their cognition, the way they think, or the motor functions. It can be so many things.
And so when we think about a heart attack, that symptom, to me, that symptom seems very immediate, and and that person can almost describe what it feels like because they're aware, especially in women. But when we see symptoms of stroke, do those seem sort of immediate, or do they seem almost like like people who aren't medically trained might not be sure what these symptoms are.
Yeah, I think that's what the main thing is. They are not sure what the symptoms are, because
Right.
if a person can have numbness or loss of sensation, they might ignore it.
Yes.
It's saying that, oh, it's just my sleepy arm
Yeah, yeah.
or sleepy leg.
My sleepy arm, yeah.
Whereas when a heart attack happens, it's the chest pain.
Yeah.
It's the pain, that's an excruciating pain that brings you more attention.
Right.
And then when they have weakness, they may think like, oh, it's again my lazy arm and it
Yeah.
will get better.
Yeah.
And they don't take it seriously.
Yes.
So those are the few things that people need to be made aware of. They are an emergency.
Yeah, you might not necessarily experience pain when you're having a stroke, and that seems to be humans' biggest motivator
Yes,
for going to
absolutely.
get medical attention. But if your brain is compromised, that should be the number one
Yes.
thing to why you seek medical attention. So we have lots of information. We have the link to community medical centers where they have tons of information about stroke and what to do, and all of the occupational therapies, physical therapies that are offered afterwards. So Dr. Wish, thank you so much for being here today. We appreciate it.
Thank you for having me.
Well, the culture of the workplace is shifting. What managers can do to retain employees and customers. The man who wrote the book on workplace culture, next.